Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Monigle, welcome and thank you for joining us for Journey Mapping to Humanize Experience. Today, you'll hear how Baptist Health undertook expansive journey mapping research to understand and enhance the patient experience and drive internal change. Our speakers today include Danny Elfenbein, AVP Patient Experience at Baptist Health, Grant Mason, Head of Behavioral Insights at Monigle, and Zack Bruggeman, Associate Director, Behavioral Insights at Monigle. One note before our speakers begin, attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Grant Mason, who will be leading today's discussion. Grant?
Thank you, Daniel. Good to see you all here today. Very excited to take you through this work that we're going to be presenting. So just to kind of kick us off very quickly, the purpose of today's session is to really share how Baptist Health used a more human-centered approach to journey mapping. There are lots of approaches to journey mapping. It's obviously a very important research methodology in what we do. And today we're going to be looking at how Baptist Health used a different approach to really enhance their patient experience and drive internal change. Just a quick bit of background on who we are. I'm going to pass it to Danny to introduce Baptist Health in a bit more detail.
Good afternoon, everyone, and good morning if you're on the West Coast or Mountain Standard Time. But Baptist Health is a growing and renowned health system with 12 hospitals, centers of excellence in cancer, cardiovascular care, orthopedics, you name it. But who we are is really made up of a diverse community of million South Floridians, plus remote workers nationwide that seek out Baptist Health as one of the top employers for themselves, their friends and family. We're 26,000 strong employees, 4,000 affiliated physicians, with a strong focus on caring for each other, for our patients, for our community. And that's
Thanks, Danny. And just a bit of background on Monigle, who is being represented by myself and Zack today. We are a creative experience company. We are all about humanizing brands and moving people. That is our ethos, that is our purpose. And we're proud to be one of the largest independent brand consultancies in the US. We have teams in Denver and New York and remote workers all over the country. But we really help our clients, and specifically in healthcare, we help our clients deliver on key insights, strategy, creative, culture activation, and branded environments. So really the full suite of brand experience is what we do. Very quickly on your speakers today, obviously, I am Grant Mason. I am the head of behavioral insights at Monigle. You will be hearing me speak a little bit about what we do and our philosophy as it relates to journey mapping. My background is very much in insights and leading our insights practice at Monigle. I also lead our humanizing brand experience study in healthcare, which we'll touch on a little bit later. Danny?
Yeah, and just quickly, I am the Assistant Vice President of Patient Experience and Digital Health here at Baptist. Been here for 9 years, but my background previously was in driving consumer engagement around marathons and zoos of all places, not healthcare. So different insight in the industry.
And then Zack?
Thanks, Danny and Grant. I'm Zack Bruggeman, and I've got, gosh, probably in the teens of years now with research specialties and experience, and really I was kind of one of the ones really boots on the ground through this whole experience with Baptist and Danny, and I'll kind of be walking you through some of that nitty gritty once we get to it. So I'm actually going to hand it back to Grant here.
Thank you. And I think one of the things we want to celebrate at this moment in time is Baptist Health and what a human brand Baptist Health has already become and recognized today. So Danny, do you want to talk to us a bit about, what it is about Baptist Health that really makes you one of the most human brands in the US?
Yeah, and we'll talk a lot about brand today, but being recognized as a human brand, it's tied to our 63 years of empowering our people to lead with heart. And that's really the core of it. Quality care with quality human interaction is a bedrock of who we strive to be. And while we're never perfect, we'll talk about that later, we don't lose sight of who and what our patients and our employees want, a welcoming experience and outcomes. So our underlying ethos is care. And in my mind, care is human. It's not just clinical. And that's what drives quality for us as a brand, as a company, and as a group of humans providing care.
Absolutely. And consumers would agree. It's not just Danny saying this about Baptist Health. Based on our humanizing brand experience study last year, Baptist Health actually ranked in the top 10 nationally as the most human healthcare brand in the US. And this study, which is developed by Monigle, is in partnership with the American Hospital Association and Society for Healthcare Strategy and Market Development. It's an annual study that is now in its 6th year. And in fact, we're about to publish the latest rankings from that study coming up in May. So just to let you know, that's coming as well, but certainly Baptist already is recognized as one of the top human brands based on that work.
Fingers crossed we're there again.
All right, Danny, we're excited to hear your story and really what you've been through with Baptist Health going through this journey mapping experience. So I'm going to pass it to you to give a bit of background and context as to this work and how it came about.
Grant, thank you. And as I go through this is something I'm personally passionate about. So if it goes long, seems long at sometimes, or if you want to ask questions, put them in the chat just as a reminder in the Q&A. But as a company, and I talk about people, when you strive to be committed to a human experience, which healthcare is probably the most human experience, you have to passionately and vulnerably seek that out. You have to be willing to explore, to get into the field, to see your people, both your consumers and your employees, and to listen and to walk in their shoes. So when I go by that premise of to care is human, we really need to lean in to that human experience. And journey mapping is an area where we have done that. And I look at it in these 3 ways, and I tend to bucket things, but we have to boldly look for opportunities. We can always do more. We always believe what we know, but things are changing on a daily, weekly basis. Our buildings, our services, the technology, our competition, our expectations from consumers, constantly changing. So you have to boldly go seek it out. You have to be humble and vulnerable. And it's not always easy, especially if you've, kind of dominated or done well in a market. So unlike most maps, the treasure that we want to find are pain points, broken systems, broken processes, because as change makers, this is really where the excitement happens. And then lastly, we have to put the consumer first. This is an industry strictly built around the needs of the healthcare provider and payer. We've got to know that. So if we know, so in order to know that we care, we have to find opportunities, we have to be open to feedback, and we have to deliver on those needs. As we start to look at, what journey mapping meant, right? The challenge here is to actually do something about it. So just quickly, all of us here were impacted by this 2-year life gap. I jokingly call it the Thanos snap, although we're still here and present, known as COVID. We actually had just begun a significant part of growth, merging with 4 new hospitals, building a new boutique community hospital, and expanding new services that we had never done before. So when we look back, and I go back to that boldness and the changing landscape, it changed a lot. So to just use COVID as a reason for, kind of change making isn't enough. We as a company have changed, our market has. So the challenge was clear. How do we elevate the experience, right, to new heights based on all of these kind of convergences of time? We engaged Monigle as a trusted partner. So Monigle was a partner of ours on the brand side already. And we wanted to go a little bit further with them because we wanted to paint the picture from the eyes of our patients, but not just our patients. And I think this is one of the unique things for me, but we also sought the perspective of our competitor patients. And that was interesting because in healthcare, anyone who lives in your community could potentially be a patient. So we need to compare. And then lastly, leveraging that insight into action, which is really the toughest thing. It's a never-ending cycle. I will tell you, most companies fail at it 80% of the time because you can't change everything at once. But we have to have a reiterative mindset, just like product management. This is the hardest part, but we'll talk about it a little more later on. So as we dove in to journey mapping, right, our goal was, how do we find the moments that really matter? The painful ones, the delightful ones, the ones that don't exist yet. And Zack, I think, will dive into that more as he goes through the mapping process. But from my perspective, if we can amplify the good and eliminate or change the bad, those are the moments that drive word of mouth and likelihood to recommend, right? So everyone knows NPS. That's an obviously important and critical score from a brand perspective. But if we do it right for our patients, and our employees, we drive another metric of success that we call team works together. And so we know as a health system that the two metrics that matter most, likelihood to recommend, that is the business driver. Team works together, that's the experience driver. And those two things are the things that matter most to us when we look into our numbers. And it's not just the patient rating or a one-time journey to an urgent care or a doctor's office that defines us, right? The experience is it's the core of a bigger, broader experience that we have defined as critical to us. And that's what our brand stands for. So as we start to look at the patient experience, the employee experience, those two things combined, and I'll show you a graphic later on, they're the brand experience. And it's all combined to really deliver on our brand promise, if you will. So we're working with Monigle to think forward about our brand, and we'll talk about that later on as well, to have a unifying mindset after all these years of change and growth, because we know that if the brand is our face and our people are our heart, then the product of a great brand and great people is a great experience. And that's what we're focused on. And so I dive into this whole process of revitalizing the experience and strengthening the brand. And as Grant and Zack take us through the how of the journey mapping, I just want to call out a couple really critical things. Number one, this journey begins and may never end for some patients. We have different patients or consumers who have different pathways, some that lead to amazing and incredible outcomes, and some that don't. That's a reality of the industry that we're in. But where it begins and where it ends is never within our walls. The experience, the journey is not in our four walls, it is outside of it. Really important to keep that in mind. And then lastly, and I think this is the challenge for some of you out there who might be on the world of insights, we already know 70 or 80% of what we're going to find out in a journey map. It's not a surprise. But there's still power in kind of reapproaching it. And more importantly, and the way Monigle's done it with us, there are nuggets that we have to look for, and there's some painful treasures, like I said on that map, that can help us really drive change. So Grant, turn it over to you.
Thanks, Danny. Yeah, really important context as we look at what we then sought out to do from a research perspective. So I'm going to start us down the road of the nitty-gritty and the process and the how. And Danny touched on something really important, which is when you're doing a journey mapping exercise like this, it is those little nuggets, it's those little moments we're looking for that can have a massive impact. So from our perspective, we like to design a methodology that is going to get to those moments-based insights and give us a more human view to that journey. Before I do that, and I always and preach this to my team, is you need to have key principles when it comes to any research approach. And journey mapping is no different. So I'm actually going to walk you through our 5 key principles as we think about journey mapping and to live by as you think about your own journey mapping studies. The first one, and again, Danny teed this up really nicely, care is before, during, and after. Care does not stop when people leave the building, okay? Care is constant even. And we see through our other humanizing brand experience study that the best way to build emotional security with people and with your consumer is to talk to them, to reach out before and after that care experience within the 4 walls. So we really have to reframe patient experience or patient journey to be consumer journey, or even better, a human experience, because it isn't just the 4 walls that we're dealing with here. From a consumer perspective, that journey starts way before and it continues on way after once they've left the building. The second key principle, and this is really important, each journey is uniquely human. I really want us to think about the journey as being centered around the consumer and not around ourselves. I know we have lots of processes and procedures, and there are journeys that happen in a very systematic way throughout our health systems, but me as a consumer, me as a human being, I am going through my own journey. And this research for us is an opportunity to make them at the center of that journey and for them to tell us the steps they're going through. So let them build their own map. Don't push a map on them. Don't push a process on them. Let them whiteboard that experience and show you what they went through. The third key principle, little changes go a long way. This is really important, but we have to accept that you're not going to be able to fix everything coming out of a research study like this. You know, to be honest, there is a lot broken in healthcare right now from a consumer perspective. And the reality is a task like this can seem very daunting. Well, focus on a few changes that have the biggest impact that you can implement, okay? There's going to be a lot of insights that come out of this work, but fundamentally, prioritize those that you can address and prioritize those that matter from a consumer perspective. It's not always big investment and significant change that can impact me as a consumer and make that process less painful for me. The fourth key insight or key principle here is to really focus on not just fixing things that are broken, but actually finding moments to live your brand. Journey mapping isn't just about fixing those broken moments. Of course, there are things in healthcare that we can fix and we will coming out of this process. But it's also about identifying, is there a moment in that journey where you can inject brand, live your brand values, and really heighten the experience and surprise and delight the consumer in a positive way, so that when they leave that experience with you, they're going to talk about it. They're actually going to share and socialize your brand with friends and family and really have something that sticks in their mind that surprised them and builds consumer loyalty with your brand. So yes, use this to fix those moments, but also find moments where you can add and inject brand and really live those brand values as well. And last but not least, so important as we know going through an exercise like this, bring stakeholders in early. Everyone within the health system has a stake in journey mapping, and activating change can only happen if all departments are brought in early. You know, we like to recommend to our clients to build a cross-departmental core team that actually has joint ownership of this work from the start. Make a plan to socialize findings once you complete the work. And also when it comes to creating that map for action and change, it has to be co-created with everyone. You know, I think this is so important. This work doesn't live in a silo, that you have this cross-departmental team early on, and that you're as focused on the socialization of the findings as you are the research itself. Okay, so those are our principles. We're now going to talk about method. Of course, research method is a hotly debated topic in this type of work. Now, our recommendation and what we did with Baptist Health is really a method that focuses on getting beneath the surface, but is also non-invasive. And I do want to talk about those two merits of this approach on the next slide. Okay, so what did we actually do? What was the method we selected? The method we use at Monigle and the method we chose for Baptist Health is a virtual in-depth interview method leveraging Miro, which is a whiteboarding solution. What does that mean? Well, what it means is we actually get folks on a Teams meeting or a Zoom meeting for 90 minutes, and they actually build their journey on Miro themselves with a moderator helping them to do so. And what you're looking at here is one of those maps that was built by one of our consumers in this study. They actually built this map in Miro themselves, and they created it with all of the stickers and setup that we gave them going through that in-depth interview. So it is a qualitative method, it is virtual, and it is actually after the experience. Now, a few of you on this call may be debating quant, you may be debating another approach to qualitative journey mapping, which is ethnographic in nature and in the moment. There are merits of all of these approaches, but I do want to talk about the reason why we chose this method and why we think this is actually a better method in healthcare for doing journey mapping. Let's start with quantitative research. Quantitative research is great. You get the validity, you get the big sample. It can really give you those numbers to give you confidence in the findings from a quantitative approach. What we find with quantitative journey mapping is, for starters, feasibility does typically tend to be a challenge, especially if you're trying to get journey maps at a service line level. It can be very difficult to find enough people that have actually gone through that journey in your market and put them into a quantitative study. But let's say you do find them, and it is possible sometimes. The other thing that's worth calling out with journey mapping and a quantitative study is you can get really good drivers and really good touch point analysis. What quantitative is not going to give you is that really in-depth emotional understanding from a human perspective as they're going through the journey. And it also doesn't enable you to probe and understand and push on those moments that really matter. So qualitative in a very in-depth environment like this can give you that. The other method that you may be considering, especially if you come from a non-healthcare background, is what I consider to be a best-in-class method, which is ethnographic qual, or even self-ethnographic qual, where people actually report and give you feedback as they're going through the experience live. That is not an appropriate method in healthcare for obvious reasons. From our perspective, it's too invasive. You know, if people are going through a cancer journey, if they're going through a very highly emotional healthcare journey, it's not appropriate to be asking them to give you live feedback as they go through that experience. In other categories it is, and in other categories it does give you better insights. In healthcare, it's actually okay to recruit these folks after the experience and put them into this type of environment, because it's given them a chance to actually focus on their health, reflect, and then we can do the research retroactively. So that's just a bit of background on the method and why we prefer this virtual in-depth interview approach after they've gone through the experience versus while they're going through it. Now, just very quickly, obviously, there is a lot of information on this page here. When we build these maps in Miro, in those in-depth interview settings, we actually do spend a lot of time briefing consumers on what all of the little stickers mean. And you can see here just an example of some of the stickers they have to play with to build the map. There are stickers that represent key people. There are stickers that represent journey steps that they can actually build and type over. The emotions they're going through, those key touch points as they're going through the journey. We also have little magic wands where people can actually tell us what they wish could have happened in that moment, what they would have changed if they were the health system in control of that journey at that moment. They can give a little thumbs up or thumbs down to indicate whether it was a good or bad experience. They can also kind of point out those key turning points when there was a significant change in the journey, but also those pain points that we know do happen and why they happen and how we could potentially fix them. So ultimately, there's a lot of stickers here that people can use to build that experience and build that personal human journey. So what does this method give us? Well, it gives us really that ecosystem of influence that drives decision-making throughout the journey. And most importantly, it gives us those critical moments that matter where we can drive change and humanize the experience. So we're really looking at those influences, those need states, the emotional, the functional needs, those foundational beliefs, and those key touch points across the journey. So with that being said, that's a lot of background on the theory and why we do what we do. I am going to pass it now to Zack, who's going to talk about how we applied this method to Baptist Health specifically.
Thanks for that, Grant. And we've talked a lot up to now about the nuggets or the moments that matter and how we can elevate the brand and what all that means in terms of the experiential point of view and where we can find critical pieces that are either a pain point or something to consider, but maybe deprioritize, things of that nature. So just a kind of a quick overview on how the research looked. So we did this last year, late spring, early summer, and it kind of went through into the end of the summer there. 5 service lines or 5 journeys is what we focused on with Danny and team. It was primary care, emergency care, inpatient, urgent, and cancer care. There were 60 people total. So you had 12 per each of those 5 journeys right there. And then, like Danny mentioned earlier on, it was kind of this even split of Baptist Health patients and their unique journeys, as well as that competitive point of view. And that's really important because it gave us a well-rounded or almost like a comprehensive, holistic point of view, not just on the Baptist key moments, but also on the model or the care service line itself as well. And then with that kind of intro you saw with the Miro board and kind of that interactive experience, it was 90 minutes. These were in-depth interviews, interactive, one-on-one for each one of them. So Each person's unique journey comprised of a series of moments, like we've mentioned several times up to now. We really broke that down into pain points, opportunities, functional areas where we had tactics to fix for their experience. So really, we started with them kind of painting that full picture of their experience, right? The beginning is this kind of canvas exercise where, because we've mentioned so many times, it's not about just what happened in those four walls, but really the triggers that led up to it, any kind of cross experiences. And then beyond, once they did leave the hospital, the facility, or that moment in their journey that classically we might have thought was the end of the journey, we wanted them to kind of create this landscape dictated on their terms. Obviously, throughout that, we kind of adapted our probes. We wanted to dive deeper. The whole idea here is to get depth and breadth. So wherever we thought it was possible, we dug deeper. And because it was that interactive experience, we didn't necessarily turn it over to them and say, you need to build this map right now, and we'll talk to you soon once it's finished. We were taking notes along the way. We were helping them to build based on that open canvas they spoke to. And that, right when we finished that, it's okay, let's revisit that now, and let's start creating your journey as you saw it. That's really when that interactivity began. So every human on here in this page represents a unique experience, and we treated them as such. So again, you've got a mix of competitor patients and Baptist patients. And this is a question that's come up a few times in prior engagements is, did it have to be exclusive, or why did we say one had to be Baptist and one had to be a certain other competitive? We weren't making it exclusive, right? But we did want to speak to a specific experience or set of experiences related to that service line that they had. A lot of times there are kind of cross or competitive kind of experiences where they might have left one and gone to another system or brand. And if that was relevant or played into their experience, we certainly wanted to know why and what factors were involved with that. So no, they didn't have to be exclusive patients for one or the other, but we did focus on a singular experience or set of with that service line. We've mentioned up to now a few times about how it was a unique journey for each one of them. This right here, you can see on this kind of quilt, is a great bird's eye view of just how unique their journeys are. That one that Grant showed earlier, now you can see it kind of how different it can be and what those experiences really translated to when they were mapped out. And that's why we let them dictate their experience, not the other way around. It's with these individual experience points that we can build towards this journey pathway that we'll see here in just a couple of minutes. So using and these are all of the actual Miro boards there. These are all from our study. We then aggregated the 60 Miro boards to create 5 service-specific journey maps that outline the universal human needs, challenges, and emotions that they actually experience. So an easy way of saying it, we turned data points into a usable pathway or system of reference that kind of captured those critical or key moments along the way. So what did that actually look like when I say pathway? After they've dictated their journey to us and not the other way around, like I mentioned, we took all of those data points to create that journey or service line specific pathway. And this page right here isn't meant for you to kind of try to squint your eyes and see all of the little details everywhere. This is something we created to be blown up to keep going forward for Baptist. It is that kind of, from all of those data points, it is that journey or that pathway for the service line. The example here is urgent care. So using all of those data points, we created that pathway at the top, but knowing in that idea that it wasn't always dictated by the in-person visit or virtual visit within kind of like that classic idea of 4 walls, we have these chapters of the before, the trigger points, the during, the after. And within that, what some of those kind of specific needs, universal needs, some of those challenges they might have faced, and really emotions they were going through along the way that we need to be cognizant of. You'll see some yellow boxes there because obviously we found out a lot of things. Something to keep in mind, and we did touch on earlier, is that oftentimes it wasn't a surprise. There are some obvious things that we expected, hypotheses that we validated, but really the idea was that we got them in their terms to tell us about those. So in the yellow boxes here, we found are some very critical moments to highlight where we can have that actionable change and what we can do about that. And then over to the right, you kind of see this overall, if we had to pin it down to a key to success, that's where that's included as well. there is a reason why I chose urgent care as our example here. And it's relevant an example for all of us because it goes back to when Grant mentioned that the little changes go a long way. So yes, we could wax poetic about how we need to teach empathy better, and that comes up in a lot of journeys and across a lot of different service lines. And yes, there's really partnering with patients. A lot of that is especially critical. We shouldn't discount it. But one of the key things we talked about is how we can actionably change and inject our brand in some of those small moments that maybe we can change tomorrow or in the near term, especially. So there's an example here with urgent care of 3 very tactical changes we can make. And there's a better reason for this, or an extra reason for why I chose urgent care is because it already works well. It's a model that Baptist Health is doing very well. So we shouldn't just say, okay, done deal, let's move on to the next journey. We still want to see where we can kind of elevate the Baptist brand and enhance the experience for the patient. So I'll quickly go over 3 of these kind of, not necessarily watered down, but 3 quick kind of moments that matter, the critical moments throughout their urgent care journey. So one, and again, you won't be surprised by this, a lot of patients were choosing urgent care in lieu of emergency or primary. I don't think anyone, again, would be surprised by that. But what we really got to do with this was kind of, there's a logical standpoint of why they would choose it, but we kind of went in deep and got the decision or the motivational reason for why they chose urgent care instead of primary care or emergency care. We had a lot of very, I always like to say they were very savvy, our patients, and very savvy to the experience and what to expect in the feedback to give. A lot of smart people. So we had not just always like, oh, I don't think it's serious enough to go to emergency care, or that's not that I don't really like a primary care experience. We got into more of that. We found out there are a lot of emotions involved oftentimes. Maybe they had these symptoms they've been sitting on for a while, and it got to the point where they've waited too long, they can't get into their primary care. So now they need to opt for urgent care. And remember when Danny said about the time or the Thanos snap that we were dealing with, a lot of this was still in effect. And when I say they were savvy, they didn't really want to overwhelm emergency care because they know of all of the kind of issues we were dealing with at the time. And they were really kind of keen for that as well, to not be overwhelming the system and burdening emergency care. Aside from the idea, of course, it's going to be a bit more of a premium experience, is urgent care kind of that middle ground. I'll quickly gloss over the next 2 just so we can keep moving here. Urgent care is something that works very well for patients, and Baptist is doing it well. That isn't the end of the story there. How can we really use urgent care and our experience with it to make it a standard experience for patients, but also make it a unique standard Baptist experience? So that's where it comes in the idea of elevating our brand and the moments that we can do that. And then finally, and you'll see it, or maybe you did already with some of those Miro boards, we had kind of the ups and downs of that honeycomb. And what we saw in urgent care was oftentimes maybe there is an emotional inflection point because we do have that dimension built into the interactive tool. Is there a point universally here where, or oftentimes there is kind of a flip, and what can we do better about that? And a lot of that does come back to the brand, right? If I use the example of how we can kind of check in with patients or follow up with them, something that came out that's quite interesting in the patient mindset, because that's what's so important here, is if we're doing a follow-up survey, if we're checking in, following up, we shouldn't be making this about Baptist. It should be more about their status. So if it's a survey, should it be how we did, or it should be how you're getting along, and really about your experience, not just for us to put into a metric that we're using on how we're doing. So some things like this, like I said, very savvy patients, and a lot of their feedback was so powerful, even in some of these very obvious things that, you know, might classically think we can always fix or we should be fixing. So urgent care was an example. And yes, each service line has critical moments and opportunities, but like we mentioned already, we're not just revitalizing and strengthening at a service line level. We are at the brand level. So each one of those 5 service lines kind of plays into a greater whole. So we had that unique pathway for each one of them based on all those patient data points, but then we build from there that kind of comprehensive pathway. So taking each of those 5 service lines, what can we find in terms of universal pain points, universal opportunities, comprehensive moments that we can inject our brand? So what you've got here to the right, it's a simple, it's a usable, and it's a comprehensive point of view on those 5 service lines that we can take at a brand level. And it's simple and usable on purpose. So if it seems simpler than all the other ones, that's by design. We're looking for those universal or parallel pathways that we can make comprehensive. But it didn't just stop there. It wasn't this experience of, okay, this is all good to know, we'll keep it in mind. Obviously, we want to take all of our insights and move that forward and put the action as we come out of the research. So I'll hand it back over to Danny actually to talk about that.
Yeah, thanks, Zach and Grant. And normally I prefer to be on stage in front of people where I can, call out and see a response. But, to Zach's point about looking at the overall journey, I mean, how many of you in healthcare have lived this terrible life of going from one office in the same brand, going to another office and not feeling like they were connected, not feeling like your registration here is the same here, and you're asked the same question, right? And so when we look at it as one unifying map, that's kind of what our brain starts to make sure we think about. And the hardest part of all of this is taking those ideas, those concepts, and activating change. And so for us, right, as we're looking at, one, I'll take a step back and say, if any of you do use journey mapping or intend to, and you're using it for a singular purpose because you want to figure out what's wrong in your urgent care, I will tell you today that you're not getting the bang for your buck. You're going to sell yourself short. You've heard us talk a lot about brand. And so for the patient, that journey it's their destination only. It's a single, right, journey with maybe multiple destinations. And those little things, like Grant says, add up to the overall experience with the brand, not just the urgent care in our world. But for me and for our team, this journey is the beginning of a lot of things. And it's all tied to action. And God knows that the hardest part about qualitative insight is doing something with it, or in my world, convincing others to do something with it. So as we moved into action, a couple things that matter. Transparency is critical. And I saw there's a couple questions that started to circulate about this, right? But transparency is critical. Like I said earlier, if we already know 70, 80% of this, well, we should be asking ourselves, why the heck aren't we doing anything about it, right? And pushing ourselves, being missionary type leaders and advocates, so living your brand. I think Grant said that as well. We got to bring this stuff to life because it's about the brand. It's not about my job or anybody else. It's about the sustenance of our brand. So challenge the company to represent the brand right. Paint the picture in a way that connects these insights to the impact on the brand. And lastly, and I think this is like my competency extraordinaire, is persistence and resilience. I mean, you don't get buy-in one time, 2 times, 3 times. You have got to push. And so I'll talk to you on the next slide about what we kind of do to do that. And to be fully transparent, our corporate office of patient experience is new at Baptist Health, but the tenets are not. And so in my mind, we've built this kind of this flow, if you will. We're collecting data and insights through different channels. So data green, you can see the different channels in blue, whether it's user sentiment, experience reviews, knowing our roadmap. We're listening and learning. We then distill and define, right? So Zack, through these interviews, which by the way, sitting in on these interviews was mind-blowing. Back to transparency, inviting executives to listen to patients in these 90 minutes was mind-numbing for them because they hear that thing that they know they need to fix, and now they're more inspired to fix it. So we distill that information and we create hey, here's our data source, here's the insight, here are recommendations, and we go to the leaders. Well, what do you want to do about it? It's not, can you do something? It's, what do you want to do? And then we start to prioritize, align on those big ideas, find the small wins, and then take action. And you can see that last column, design a workflow, implement it, test it, adjust it, measure it. And that's what we're trying to build as kind of a voice of the patient or voice of the consumer team. Real quick, executives and stakeholders in our world, that includes physicians and physician leaders, are informed at the beginning, invited during the interviews, and engaged at the end. In our health system, sometimes that means an 80-person meeting for Zack to do a readout. It can be overwhelming. but the questions start to pop up in side channels, and that's really where we start to see action. And again, if we move forward, what this all ties into is the brand experience. So when you look at this image, right, I think this is an image for all of you in whatever industry you're in to consider. Your consumer or patient experience is fed by your employee experience, which feeds your brand experience, which I said earlier on, right? The brand is the face, our people are our heart, but the consumer's experience is the product. And this is how we look at it. And so I could tell you all the things we did do, or I could actually walk you through a couple of them with the time we have left. Number one, I said, if you're only using the journey to identify issues along the journey, you're shortchanging yourself. So we wanted to align, you can go to the next slide, Zach. We wanted to align around who we are as a company, One Baptist Health. And I don't know how many of you are from this market or how many of you have multiple different entities under your brand, but this is what we look like to our consumers. We look like this confederation of multiple locations, some of which, by the way, don't even say Baptist Health when you actually zoom in if you try to. We add it in like a little green line on the bottom. And so you have to understand that our patients see us as one interconnected health system, but they read us as multiple different entities, and sometimes our own employees do that too. So this idea of one connected system rang loudly from our patients' perspective, which led us to really use that information to kind of unwind this crazy, confederation of brands into One Baptist Health. So this notion of One Baptist Health carries significant weight in our system right now. There's a lot of work going on around this from a cultural perspective, from a branding perspective. So again, journey maps were not about this, but journey maps led us to understand how important this was for our patients, for patients' our reputation in the marketplace, patients understanding who we are and where we are. So again, journey maps, multiple purposes. One of the other purposes moving forward is helping to set expectations around our culture. What are our standards? How do we define them? And how do we start to build a culture around those standards? Again, been through a lot of change. We have people who haven't sat in a room together for 2 years. And so we said, we need to get everyone back together. And the best way to do it are core values and standards, and using those standards to drive behavior. Because if we want our patients to have these amazing moments, we need our people to deliver them. And we have undertaken this significant effort led by our patient experience office. For the first time ever, we are deploying system-wide training for all 27,000 of our employees. By the way, 10 years ago, we had 15,000. So you talk about force change. So we are now, I hate to say it, indoctrinating them into this notion of a welcoming experience. It sounds so crazy and it's so trivial, welcoming experience. But I don't know if you saw when I started, I said hello. As someone who used to oversee telehealth, we want our physicians and our staff to say hello on screen. That is a basic tenet of a welcoming experience that we need to kind of perpetuate across the system. So we've done these trainings and it's led into these values and experiences, these experience standards, right? So you can see our 5 values. We're pretty transparent here. And the standards that align to them here: people, belief, compassion, excellence, integrity. And each of these values has a standard. And what we're going to be doing over the next year is rolling these out in meaningful ways across the system so that we hardwire all of this based on journey maps, but not only journey maps, to deliver on the experience that we know our people want. Additionally, we have to actually deliver something tangible to the patient, right? Like all that stuff is esoteric, cultural, philosophical, but we need to give them something that they can feel, they can touch, they can remember. And we're calling these pineapple moments. These are little experiences, and we're just at the drawing board on this. I think this project will live on for years. But as an example, when we look at delivering these pineapple moments and actualizing some of what we learned from our journey maps, we started kind of just putting some sticky notes up around each of our standards. something silly right there in the middle, waiting room treats. Well, we took those away during COVID. A lot of people did. You know what? Those little graham crackers and coffee and a pineapple shaped cookie, that is a moment of delight for some people. And we have to recognize that. So delight is critical. And these Post-its are just examples, but and some of this, to be very honest, is very superficial, very easy to do in theory, but we have to know it needs to be done. But the harder part, and what we're really trying to do, and when we look at patient experience and action, is on the next slide. A big part of my team looks at workflow and process improvement. And so I'll give you a real example just to be fair, to make this meaningful. Zack talked about cancer care as one of the journeys. We found out that when you are done with your cancer treatment and you ring the bell at Baptist Health, that wasn't enough for a patient. A patient felt like, hey, why didn't I get to ring the bell or get recognized along my journey when I crossed all these other milestones and thresholds? Because for some of those patients, they needed that incentive to keep going. And sadly, for some others, that might have been the last milestone that they crossed. So we heard that feedback, and what we believe is these three nodes: empowerment, right? The ability to kind of self-serve, contribute to their own care and decision plan; information, reliability, timeliness, accessible information; and communication, open and clear communication, feed control. And I don't know about you, but when I take off all my clothing and put on scrubs, I lose control. I am now under the watch of everybody else and not myself. So we are looking at how all of this journey mapping wraps up into giving back control to our most vulnerable people at their most vulnerable times. Lastly, everything that I've shared, right, is really easy to talk about, but the work is so hard, and qualitative work is hard. So at Baptist, we often, everyone hopefully saw the pineapple is our emblematic logo, it represents hospitality. We often use pineapple juice as phraseology in our culture. And it's not something that you can buy off the shelf. It isn't easy to squeeze, right? Actual pineapple juice comes from a pineapple. And it takes 2 years to grow that pineapple. That is analogous to the time that we're investing in nurturing our people. They're the core, the heart of our company. And a pineapple has a thick, strong, and totally recognizable exterior. That's our face. That is our brand, quite literally. And on the inside, if we do all this well, if we grow the pineapple, if we grow the culture, if we build this unified exterior that's recognizable, right, then our core will be full of that sweetness, that welcoming experience that we believe is a care we have to give our people. Grant?
Fantastic. I love that analogy and I love that sentiment, Danny. I think that's a great way to close the conversation. On this page here, we just have a summary for you all today of some of the key takeouts around our principles, around our methodology recommendation, and really the process to consider as you're going through an exercise like this. I do want to emphasize some of those key principles and selecting a method that does get you beneath the surface, that does get you to those critical moments that Zack was talking through. And of course, the process, I think Danny's done an incredible job of articulating how we got to this point, how we started down this road within Baptist Health, how we got that internal buy-in and started to activate change as it relates to those experience standards that the organization are developing as we speak. So with that, I see there's some very good questions in the chat, and I do want to give folks a chance to type some more questions now. But I'm going to start with what I thought was a really interesting question that relates to really kind of the representation and the methodology. So Zack, I'm going to pass this one to you. What methods did you use to ensure the patient population used is reflective of the market?
Yes, sorry, I muted and then unmuted myself, so apologies. Hopefully everyone can hear me. So we wanted to make sure that we were representing not just geographically, but also within different types of that experience. So when we were going through, if you remember, we had both the Baptist point of view and the competitor point of view. So one, we made sure we had geographic representation, but because it's qual, you don't have the the kind of benefit of getting 1,000 people, so then you can hope for that confidence of that spread to give you that representation. So we made sure that, one, we had very specific criteria, not just the geographics, but also what constituted the experience of that service line. Did we want to exclude freestanding emergency departments? Did we want to include? These are conversations we had very closely with Danny and team for several weeks, actually, to make sure that we were getting kind of the breadth as well, and making sure we were as kind of honed as we could be. So that's part of it. And then the other part was representation of the actual experiences themselves. If it was emergency care, we didn't want to have everyone who came in because they fell and broke their wrists or something like that. Were there some that brought themselves? Were there some that kind of came in by ambulance? We wanted to make sure that we were crossing all of the boxes within the realm of possibility, obviously, to have a diversified experience. So there was the geographic part, there was the actual experience point, but then also there was the brand or the competitive point of view as well. So obviously when they came through, they had to qualify, they had to meet this criteria. Then we actually kind of had a pre-vetting process, just like you do with Qual, where we spoke to them and we made sure that they were a good fit and that we weren't getting everyone who had the exact same experience. So then we kind of pigeonhole ourselves into assuming the same for the rest of the experiences within that service line.
Perfect. And while you're still on, Zach, very quickly, what sort of incentive did you give to patients to participate in this?
Great question. So there was a monetary incentive. Basically, it's 90 minutes. And a lot of times we didn't give them homework or anything beforehand, but they did it qualify. So they did take that kind of profiling survey. That was pretty quick. And then because it's 90 minutes, because at times, even like, for instance, with the cancer journey, it got quite emotional a lot of times. Whether they were still in that journey, because that one has kind of much more of a long experience. If I'm remembering exactly, it was somewhere around a payout of $150 for 90 minutes was a good example. We want to make sure that their time was valued. Thanks, Ron.
All right, I'm going to switch now to Danny. I love this question. How do you make sure the work is completed? Do you have teams, possibly agile, helping to implement these concepts throughout the organization? Or do you hand off the ideas to other departments to tackle?
Yeah, so I'll answer first. With persistence, resilience, and a missionary mindset, right? That's how you actually make sure the work is completed. The Office of Patient Experience informs, influences, and at times incubates. So to answer your question, if we are trying to solve for urgent care check-in using technology, we go to our technology team and say, hey, and I mentioned product roadmaps earlier on, we need to find a place for this, or if it already is on your product roadmap, we're informing the how and the why behind it. And they may use agile methodology for developing whatever product or technology they need to in that instance. Likewise, we have process improvement needs or workflow needs for our physician offices. So we'll sometimes dive in. I have project managers that might dive in and support, manage, or drive process improvement. So it just depends, but mostly it starts with conversations and to say, look, there are 6, 7 problems or pain points. Let's find one. You want to find 2? Go for 2. And that's really, leaving that room with 0 is not an option. That is the most important part of this. And that's the persistence piece.
Absolutely. And another question from another participant here. Do you do your own marketing research, brand, patient perception, etc., in addition to the Monigle research? Has this journey mapping been embraced internally? So to you, Danny.
Yeah, so I can't speak too much on the marketing side. I'm not in that area, but we do have other insights that our marketing team does from a brand rep and kind of brand recall perspective. We're in multiple different markets, so we do have to understand how that plays. But from the second part of your question, right? Journey mapping is embraced wholly by some, not so much by others. There are some, look, in any organization, you're telling me what I already know, right? So it just depends, and it really depends on the person who delivers the message. In my case, me and my chief experience officer, when we deliver the message, like I said, we don't want to walk out of the room with 0 action items. There has to be 1 or 2. And a real example real quick is when we hosted 70 people for our emergency care readout, I had 2 emergency leaders who had never reached out to improve anything in their world through us before, immediately set up meetings to talk about how do we resolve this issue, how do we solve for that, And that's really what you look for in a large company is get the small wins, create FOMO, the fear of missing out, and then build off of that.
Love that. Thank you, Danny. One more question for you, Zach, that came in actually before we started today. Did we actually use this journey mapping methodology to speak to referring physicians or donors?
So we didn't actually in this case. This one was all just on the patients who experienced it, but donors, we could do a separate journey. It would be that donor journey, and we could represent that, and it would be a little bit different in how we would frame it up and how they play back their experience. But the referring physicians obviously would be a bit different and wouldn't necessarily apply as well as a journey mapping because they don't have that kind of journey necessarily that you have in a patient or a donor.
Love that, Zach. And then I know we're very close on time here, so I'll take one more question. And in fact, I might take this one because I love this question. What are some of the qualities or tools of the moderator that help them make this successful? It seems like because of the emotions, it would be a critical role in this feedback. That's a really excellent observation. And we are very careful with the moderators we select for this type of work. You know, you're talking to people who have had cancer and very severe accidents that have happened to them, and they're reliving that journey and the emotions they've gone through across that journey. And when we select moderators, of course, they have to be capable and competent with Miro and the tools for virtual IDIs. But what's most important is that they're empathetic and that they are able to listen and encourage and are able to handle those emotionally challenging situations where sometimes you do have participants get upset, understandably, going through the interview. So, you know, I will say though, what I did find encouraging is that even though these are very difficult interviews to do, oftentimes we had our participants saying to us, it was therapeutic. They actually hadn't stopped and reflected on that entire journey they'd been through, and going back and thinking about it, it actually helped them move through and move forward. So that was very encouraging to hear as well. So I know we're at time now and there's lots of questions we didn't get to, and you know, hopefully we can still respond to these after the webinar, but I do just want to pass it back to Daniel just to close us out for today.
Thank you. We've come to the end of our program. I'm sure the audience joins me in thanking Danny, Grant, and Zach for sharing their expertise with us. Thanks also to all of you for carving out time to join us for such an important conversation. Please note that if you asked us a question that we weren't able to get to, we will do our best to get a response to you. The forum will also be sending out a link to the webinar recording and slides in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at a future webinar, as well as at the Healthcare Marketing and Physician Strategy Summit, April 17th to 19th, 2023 in Austin. Check the forum website, healthcarestrategy.com, for details. That concludes today's program. Thank you and have a great day.